Hello there, this is John, and I wanted to give you a heads up. Next class meeting, we will be going over how to obtain a complete set of vital signs, and I wanted to focus on the equipment that you're going to be using to obtain a blood pressure. Now, more than likely, you purchased your equipment already, hopefully, because you need it next class meeting. But I would imagine you probably got something like this, a 2-lumen or dual lumen scope, as you see right here. You need to make this your own personal piece of equipment. It needs to fit you comfortably and so you can use it effectively. So I wanted to point a couple features out. If you go to the head of the device, there's actually two sides to the head right here. There's a low pressure side, which is the larger of the diaphragms. You see the big diaphragm with a plastic coating on it. This measures or listens for low tones, so we use this for taking blood pressures. We use this for listening to lung sounds. Primarily in the field, this is what you're going to wind up using as an EMT. The other side, you might have what's called a bell, which is what you see here. It looks like a bowl. You might have another smaller diaphragm. Depends on the brand you purchase. Either way, it works the same way. The smaller of these two heads, this listens to high tones, so possibly stridor sounds in the neck, maybe the heart tone of a newborn child might be the thing you're going to listen for on that. Very rare things that we do. Predominantly, you're going to be working with the larger diaphragms you see here. I also wanted to point out here, more than likely you have the same feature that I have. You'll notice there's a green dot right there. The dot indicates what side of the head is active. So right now the active side is the larger diaphragm side. It's the side we use pretty much all the time. If you were to turn this head around the other way, now the smaller bell would be active for those higher tones. But we usually predominantly use this one, so we want it on this side. We want the arrow or the dot, I guess, facing that way. So now that I have that, I'm going to take this device and make sure that that diaphragm is facing towards me, towards my body. Then I'm going to go up to the earpieces, and you'll notice the earpieces come out of the packaging pretty flat. And our ear canals are actually facing forward towards our nose. So I want to twist this thing, and you can grasp the two metal pieces, earpieces, and you can twist them either way. And what you want to do is you want to face them forward towards your nose. So when they fit in your ear canals, they're comfortable. Now, if you notice that the earpieces feel loose, like they're kind of hanging on your ears, you need more tension, you can always cross them. You'll notice I cross these pieces. It increases the tension of the spring. If they're too tight and it hurts, you can also spread the spring out to relieve some of that tension. So now that you set this up to where it fits you and you have a good, nice, comfortable, tight seal, and you can maximize your sound and what you can hear, then you're ready to go on to the next step. So now you have that ready to go. Your next piece of equipment you're going to be using this next class meeting is going to be your blood pressure cuff. Now this right here is an adult cuff. It even says right there, it says, whoa, over there, it says adult on it with this. There's 4 different sizes that we can use in the field: infant, child, adult, and there's one larger one called a thigh cuff, and it goes on someone's thigh, or heck, someone who's really obese, it might fit on their upper arm as well, depending on how big they are. A couple of features I want to point out. First thing is you can see the gauge. I'm sure you probably looked at yours already, but this gauge right here measures blood pressure cuff in millimeters of mercury, and it goes from 0 to 300, and you'll notice that there are no odd numbers on this. Each little line on here represents 2 points. So when you're getting a blood pressure using a manual cuff like you see here, you're going to be recording and documenting even numbers only. 122 over 72, 118 over 94. It's always going to be even numbers. You can only obtain even numbers on this device. Also, right behind where the gauge is, this lower half here of your cuff, inside here in a pocket here, there's a bladder. And that bladder is inflated by using this inflation balloon. And the purpose of this bladder is when you apply it correctly to the patient's arm, the bladder rests on the medial side, the inside of the arm, And as you inflate this, the bladder pushes against the brachial artery and it shuts off the blood flow distal to the cuff. And so now you've shut off all flow of blood from the upper arm down to the fingertips. And then as you start to release that pressure in a nice organized way, you're able to slowly have the blood return back to the arm, and you can listen or feel for that first returning pulse beat, and that's going to give you your systolic blood pressure. So you need to completely occlude this artery and then allow it to open up gradually in some kind of controlled manner to do a good proper blood pressure assessment. So we want to make sure that this bladder is in the right spot. So what you'll notice on yours is probably somewhat similar. On mine right here, if I can straighten it out for you a little bit, it says artery left and artery right. So you need to find the brachial artery on the patient prior to applying this to their arm. The way you find this is you have the brachial artery runs medially under the bicep back here, and when it gets down to what's called the antecubital space, the antecubital space is the bend in your elbow, where my finger is right here, where your elbow bends. In here, that's the antecubital space. When this artery comes up here, if you flatten the person's arm out, as you see here, nice and straight, it brings that artery closer to the skin, more superficial, and it's easier to find. It's always going to be on the medial side, the inside of the elbow here. So what you want to do is, just to start things out, to give you guys a point of reference, if you put your two fingers on the patient's bicep muscle, and you run your fingers down the bicep until it disappears in the antecubital space, you stop, and then slide your fingers about a half an inch medially, so towards the midline, and push in. You're probably going to feel your brachial artery right there. Now, if this person that you're working with has really massive muscles, you might have to dig under the muscle a little bit, but it's going to be there. That's where your artery is. So now that I know where that artery is, now I can point that arrow, whether it's a left arm or a right arm, towards that to maximize the chance that that bladder is going to be in the right spot. Additionally, with this, these do come in sizes, like I mentioned, and it's really important that they are fitted correctly. So this particular cuff, and yours will probably have the same thing, on the inside of the cuff, there's actually a range of fit, and it corresponds to an index arrow on the outside of the cuff by the Velcro. So logic dictates is, if I can make this work here, it's kind of hard doing it backwards, but if you can see where you can see very well, the index arrow should wind up somewhere within this range, and then we know it's the correct size cuff for that patient. So be careful about that one. So now I'm ready to apply this to my patient. I want this to cover about 2/3 of the arm. And once I apply this to the patient, I want the bottom margin, the bottom edge of this cuff, to be about 1 inch above the antecubital space. It gives me room to listen with my scope and all that. So with the patient's permission, implied consent, whatever it might be, I'm going to make sure the arm is at the level of the heart, and I'm going to apply this nice and snug. It should go on nice and snug. I'm going to point the arrow towards the left brachial artery on this patient. It's his left arm, and I'm going to make sure it's nice and snug. Make sure the Velcro is nice and tight. This thing should not slide off freely itself. It should stay on without you holding it. If you have any extra, like little flap like you see here, you can just always tuck it under the gauge out of the way as you're listening or feeling for blood pressure. Now that you have it properly placed, properly positioned, you now need to inflate it. So when it comes to inflating this device, you have the inflation balloon here. The problematic part of all this is this little silver inflation valve right here. So if you turn this all the way to the right, righty-tighty, you close the valve, and it allows the air to be directed into the bladder. It does not allow the air to come out. It goes into the bladder. It doesn't come out. Bladder inflates like a balloon, and once you start to turn this valve back to the left, you open the valve up, the air will escape gradually and slowly. It's important that you learn how to use this valve. It's the trickiest part of this whole process. So turn it all the way to the right. You're going to inflate this cuff until you reach the appropriate amount of pressure that you want for this patient. And then when you go to deflate it, you only have to open this valve a quarter of a turn, an eighth of a turn. It's going to be kind of a feel process for you. And you're going to let this air out, and you're going to watch that needle drop nice and slow. As you're watching the needle, you're going to be listening for the very first beat that you hear with your scope, or you might be feeling, you might be palpating a blood pressure. Maybe that first beat you can feel under your fingers. The very first beat you feel, the return, is the upper systolic number. And now the artery was closed, now it's starting to open. And at some point it gets open wide enough to allow that beat to come through. That's a very first pulse. It's the very first beat. That is going to be your upper blood pressure. Once the artery completely opens and you no longer hear anything, at least when it comes to auscultation or listening to the blood pressure, then that is the ambient pressure inside your arteries, which is the diastolic pressure. So as you're going down, as you're gradually lowering the pressure in the cuff, and as gradually as the needle is dropping, you're observing the needle drop, you're listening or feeling for that first beat, and if you are auscultating or listening, you're going to continue hearing it drop, and once that sound disappears, now there's ambient pressure in the arteries, and that's going to be your diastolic number. You're going to record those two numbers, upper and lower number, in a kind of a fraction setup. Or if you're doing what's called palpated blood pressure, you're feeling the radial artery, you're feeling for that first beat, you're only going to get the systolic blood pressure, the upper number. And again, it's going to be in a fraction. So 120 over palpated, or 120 over palp is how you would document that. Anyway, I strongly encourage you to play around with these over the weekend. And when you get to class, this next meeting, you'll have some hands-on, get a feel for how it's applied, get a feel for how the valve works, and all that great stuff will greatly improve your experience in our next session. See you then.